My second question is regarding neurodivergent brains and the use of low-level laser. So I was diagnosed with ADHD last year, and since then I've been a massive advocate for neurotherapies and diet and other practices to help people with ADHD and autism perform better, get the most out of their brains. And following a car accident in December, which is where I first was introduced to low-level laser, I became very aware of the potential benefits for brain function and brain health, particularly in neurodivergent populations, but also with regards to traumatic brain injury or neuroinflammation. I'm wondering if any of you have looked into or have any experience with using the laser specifically with those populations. I feel as though there's a tremendous scope for bringing low-level laser, especially with children due to the obvious lack of side effects, to help bring energy into the brain, help with neuroinflammation, help with modulating neuroendocrine hormones, anything sort of to do with getting the best out of the brain and putting the brain into the best possible state, so that things like cognitive therapies and appropriate education and support can then be layered on top of that. But I'm very much an advocate for working at cell level, because I do think, particularly with ADHD, there is mostly a biochemical situation that brings out cognitive deficits, or what is sort of mistermed as cognitive deficits, which actually just that child or that person needs more support than a neurotypical person. So I'd be interested to hear if you have any experience, as especially through my own experience, I found that clinical research tends to be somewhat lacking in actually how to apply these things, and obviously it's very new, so it'll be really interesting to hear your take on those.
It's a great question, Sarah. Trevor, do you want to start us off?
Sure, yeah. So I don't know if Sarah's aware, we actually have an autism study submitted to the FDA, and it was a quadruple blind. Not only did we look at the control and treatment group, Steve Shanks would not submit a study to the FDA if it didn't do really well. So we're just waiting for the FDA. They're a little bit behind right now on their processing of these things. But then we did the 1-year crossover where we took the control group and treated them as well. And that was just using base red laser protocols with them, and it did really well on that. So watch for that to come down the pipeline, and hopefully it's coming out soon. With that said, with the ADHD stuff, we're getting everyone, like Dr. Silverman had mentioned, obviously most of those people need to be aware of like your food eliminations and your omega-3 fatty acid ratios and different things from the nutrition side of things. Brain gut axis is critical here, but just moving up, that's very much a dopaminergic norepinephrine based activity that we need to work with. So what we do with those cases, actually that's a situation where when I'm working with the kids, I'll do different things like overlap saccades and interactive metronome and different things like that while I'm lasering. And I'm going right after more midbrain basal ganglionic stuff. So you may see me do frontal and nasal types of laser exposure while I'm working with those kids to kind of increase a little bit more focal activity. And then what I do is I finish those patients with that, again, a nice interconnectivity type of thing there. Because with the spectrum kids, a lot of times you'll see they do really poorly in right prefrontal activation and poor right mirror neuron activity and things like that. So you'll see me even bias my finish of my lasers with like left cerebellar, right frontal activity. I may bring in that when I'm finishing with them, that nice 1 hertz again for for the hyperactivity stuff, for calming them down. Again, that vagal stim is really good for resting, digesting as well. So you may, that's another good thing, that 110 frequency, and then do more of a right frontal bias while you do your neurological therapies with them.
Thanks, Trevor. Rob Sullivan.
So with the ADHD, it's interesting, the branches, and I'm a big vagus nerve guy, as Dr. Barry had alluded to. The right side, the branch is a little different than the left side. The right side of the vagus nerve is more mood and behavior, hence the idea that I would emphasize the right side. And certainly when we say vagus nerve, it's bilateral. So even though we say it singularly, it's bilateral, there's 2 nerves. So I'm big on upregulating the vagus nerve on the right side. At the same time, the auricular branch has been shown to have positive effects on autism. And that's where I personally have found that the red and violet, there's a good study that Erchonia did. Add that to the auricular, right? Just put the EVRL right in here, very simplistically. When we talk about autism, the last study that I read, 90% of autistic children had leaky gut. So once again, we're clearly going to end at the brain, because that is the ending point, if you will. We're going to laser the gut, and we're also going to laser bidirectionally, stimulating by using the vagus nerve. So everything that we're all talking about, we're all saying the same thing. We're all singing the same song, except some are rock, some are country, some is disco or whatever. I'm giving my age away. But the bottom line is many of these things are, again, lifestyle, laser, and really that gut to brain, that brain to gut axis. I mean, when I looked at COVID-19, if I could just segue there, I know that we're not talking about that. What I learned from that was it was gut to lung and gut to hypertension. And all that registered was where? In the big chip called the brain. So once again, for the autism, we've got those studies coming out. For ADHD, again, go to that vagus nerve, take away the sugar, take away the artificial coloring. And I know we don't, and Simon, I'm going to throw this out to you. Right? I know we had went back and forth on our next panel. So my suggestion for the next panel is nutritional implementation or functional nutrition with low-level laser therapy, because we all keep talking about that a little, and that really shows a synergistic approach that we're all trying to purport with low-level laser therapy in this panel.
Yeah, very good. Jake?
I love both those answers. One thing I come back to with these kids is the primary goal of the brain is movement, and that's not just the skeletal muscle, that's cardiac muscle, and that's oculars, and that's your whole lot. But this idea that the brain is trying to move towards or away from a target. And what we see in a lot of these kids is that hypermobility, right? So they're all super hypermobile. So we evolved through producing movement, feeling what it was like, and getting that beautiful feedback system of doing something and getting feedback. And when we have hypermobility, you don't get so much feedback from those joints. So these kids don't get the feedback to feel what it was like. So I'll do the same things as Trevor was mentioning, but I also want to give them strength exercise, get them gripping things, put percussors on their hands, get them to engage with their hands and basically use tools so they get that feedback to the frontal areas. You come up with the idea, you think about how you want to activate it, how you want to do it, and then you feel what was the result. And if they're not feeling what that result was, then they're not going to develop the frontal areas more. So I want them to get engaged in games that get them manipulating things, puzzles, all that kind of stuff. At the same time, I have the laser over the frontal cortex and cerebellum in particular. And then using things like your cross-call activities and cross-body activities to try and get some of that left and right hemisphere integration. That's my part.
Thanks, Jake. Rob Sullivan? We're going in that order.
It's not really my area, guys. It's something that I have a huge interest in. I think when I'm looking at things like this, I'll always look for or try and identify which part of the cortex is weak and try to aim to balance those. I think with everything that I do with a laser, where possible, if it's an injury of some sort or a condition or whatever, I always try to incorporate movement, cross movement, etc., into all of that to try and bring things back to balance. I don't have anything to add to this discussion because really it's not my field of practice. So I'm going to leave it to the experts.
Great. Sorry, Kirk, because you went out and you were back in again, you're showing fifth. So over to you.
He's become me.
That's all right. That's right. So for me, this one's really personal because growing up, I had ADHD. So I know what it's like going through school, struggling with that. I was the classic kid who would do his homework and then forget it, or, tune out as the teacher's talking, always in trouble because I couldn't sit still. And then I had adult ADHD as well. I even had Tourette's as a kid too. So I had different tics. I had blinking, grunting, whistling, all these things. So I know what it's like going through that. As an adult, the ADHD was affecting my practice too, and it was lasers were instrumental in helping that. So definitely everything everybody else has said is phenomenal. One, and I do the same thing too with incorporating movement and the type of stimulation they're talking about. One different thing that I've done with myself, guinea pigging myself too, is I've used some other devices stacked with my laser that are very inexpensive. So I've used on my phone, there's some apps called binaural beats or BrainDroid that send different frequencies of sound into your ears to create brainwave entrainment, and you can set it on different ones that are pre-programmed. I did it to stimulate the frontal lobe, since that's where I had a lot of weaknesses. And so I would have those going while I did the laser on the settings that Dr. Barry talked about for 10 minutes. I would do that. Or I'd use a Muse headband too, that it has a little EEG sensor that sends a signal to your phone that will give you basically really inexpensive biofeedback of how your brain waves are functioning in the frontal lobe. That if you're focused, you will hear it very quiet and calm and hear some birds popping out. And if your brain waves aren't very controlled in the frontal lobe, you're going to be all over the place and hear this loud wind and rain. And I stack that with the laser at the same time. And that's one thing I'll do with some of my patients too, is I'll stick them on, like say the Muse device with the laser at the same time. I can do a 10-minute session. It'll take them through a guided meditation as I leave. And we see really good results with stacking those two things together.